community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to the show. It is Bobo, 103.1 FM. It's Dane hanging out with you, and the next week means that HSA is back in the studios, and it's a pleasure to have them here. They're going to be talking about something very special, these young ladies that are here. I'm going to have them, as always, like we like to do this, have them introduce themselves, their titles, and how long, obviously, they've been working with the HSA team.
Hi, I'm Camille Blake. I'm a medical microbiologist at the HSA. I've been working there since 2021 with across all the specialties, really, but my primary base is in the laboratory.
Camille, you're dating, obviously. Are you married or in a relationship?
I am married.
Okay.
I've been married for a while.
Does your husband have a very difficult time explaining what you do for a living?
No.
He doesn't?
Fortunately. Or unfortunately.
Yeah.
Since COVID-19, people understand what a microbiologist is because of Dr. Fauci. So prior to 2020, it was very difficult to explain to people what it is you do.
Yeah.
I'll give you a joke. When I used to go through immigration and customs and border control, and they'd ask, what do you do? And I'd say, I'm a microbiologist. And they give me a little look. And they're like, what does that mean? I say, I work with viruses, microorganisms, bacteria. They're like, are you bringing anything with you? Like, no, I'm one of the good guys. One of the good guys. But I think most people's prior experience with microbiology has always been related to something bad, like, anthrax or something like that. But since 2020, I think people have a better understanding of laboratory doctors and our role in healthcare and how we assist patients, as well as public health.
Oh, wonderful, Camille. Thank you so much for being here in the studios with us. Did you mention how long you've been working with HSA?
Yes, since 2021.
Okay, so a while. A while. I figured you got that job because of COVID. 2021, because we started COVID in 2020.
In 2020, I think COVID helped to put a little bit of fire.
Yeah, we need people like you.
I do think there was a plan, to expand the services at the HSA, because I think they're always looking to see how they can improve or expand what is currently being offered to the public.
Okay, wow. Your job sounds complicated, but it seems like you love it.
Very fun.
Yeah, you seem like you have a lot of fun with it. Thank you, Camille, for being here in the studios and joining us today. And we do have two more females that are going to introduce themselves and titles and how long they've been with HSA. And we'll start with the second one right next to Camille.
Okay, so I'm Dr. Glendee Reynolds. I'm also a medical or clinical microbiologist, depending on which term you're used to using. And I'm so happy that Camille has gone through what a microbiologist is and how we get to this point in life. I have been at the HSA since about April 2023. It's been good.
Okay, who's next?
Hello, I'm Ramone Gayle, clinical pharmacist with the HSA. I have been there. This is my 18th year at the HSA.
Wow. So, about the same time that you would have stayed in school for, right? Because becoming a pharmacist is a lot of years.
It is. So essentially it's 4 years and then there's 1 year internship. And to be a clinical pharmacist, additional studies are required. Yeah. So that's an additional at least 3 years in total.
What, put you in this career? Why did you want to do it?
So it definitely is a service-oriented role, and that's really our purpose for being here. And the HSA does have a diverse group of professionals, and we do strive to ensure that our patients are given the best service.
Amazing. Thank you. Anybody wants to add anything to that, or she pretty much summed it up well? Good job. Thumbs up. Love it. Guys, we are talking about how to use antibiotics wisely. It is one of those medication that I might be assuming, but I kind of feel like it's the medication that people think that fixes everything. It's one of those things. If you have this, just take this and you will be just fine. Now, for those that don't know what I'm talking about or what the medication is, we don't like to assume. There might be some people that don't know what I'm talking about and what the necessary needs to have this discussion is. We're going to jump into it. These are experts in their field. And one of the first questions I want to ask is, what are antibiotics and how do they work? And that can be for anyone.
So antibiotics are a group of drugs that through various mechanisms are able to either stop or halt the growth of bacteria or kill bacteria. So they belong to different groups in terms of their mechanism of action and how they perform the killing. But what is important to remember is it doesn't treat all microorganisms, only bacteria. And certain types of bacteria will require specific types or groups of antibiotics. So one antibiotic may not be able to treat all types of bacterial infections.
Okay. Is there any more summaries that you guys like to add on that?
Well, what I'd also want to add is sometimes persons interchange the terms antimicrobials and antibiotics.
Yeah.
Antibiotics also, basically, they come under the title of antimicrobials. An antimicrobial is a drug that is used to treat microbes, whether that's virus, parasites, bacteria, etc. But that specific group that treats bacteria are called antibiotics. For viruses, antivirals. So again, if you have common cold, which is likely due to a virus, you really need not take an antibiotic unless there is a secondary bacterial infection on board.
Yeah. In Cayman, there's a lot of people that's used to taking medication without prescription. So can we talk about how common it is for people here in Cayman to seek antibiotics without prescriptions?
Okay, so in regards to seeking antibiotics without prescriptions, by law, all antibiotics do require, or all antibiotics, they do require a prescription. So essentially a patient should not be receiving antibiotics without a prescription. And we do understand the reason for that because there's an increased risk of resistance. Also, it could be a case where an antibiotic may not be warranted for what they're treating. So it's always important for patients to seek medical advice before trying to say, okay, my brother or my sister received antibiotics and so try to share antibiotics. So it's very, very important to seek medical advice before taking medications that have not been prescribed for you.
Okay. And is that ever sold? Like you can go to the pharmacy and just get it on over the counter? No, that's something you have to go to a pharmacist for, or a doctor? Not
antibiotics. Antibiotics specifically require a prescription by law.
And how are people receiving antibiotics through the doctor or if they're not getting it over the counter? How are they receiving? Because obviously this is an educational piece that we're doing because people get it without prescription,
Absolutely.
Right?
So I think the issue is that we have to remember that we're a multicultural melting pot. Yeah. So people may originate from somewhere where antibiotics are not restricted. So I don't want to call names, but there are islands within the Caribbean, which are very close by, or you can buy antibiotics over the counter in a similar way you could buy Tylenol over the counter. So if you were to purchase antibiotics and carry them in on your person or in your luggage, they can inadvertently get into the island, especially if it's not something that you declare to Border Patrol or Customs, and you can get it into the island, not prescribed or not dispensed by any of our registered pharmacists, but it could be available. And this is the heart of why we're here. We want to encourage persons to not share medications that they may have purchased, whether it was legal where they purchased it from or they acquired it in some other form. And we don't want them to use it without a direct, what should I say, under the care of a physician. And we do not want them to share these medications with anyone in their circles.
I mean, it sounds like it's let's just be honest, it sounds like it's common sense, but it happens more common than people can ever believe. Like people are sharing medication or pretending to be doctors or saying, hey, if you feel this way, this worked for me.
Absolutely.
But there's a science around this, guys. Literally, there's a science around this. And that's why these ladies spend so long in school. I think one of these, I'm eager to understand what this is. So AMR is what I'm going to refer to it as, because that word is very dangerous to say on the radio. But why should the public be concerned? First of all, break down what AMR actually means and why should the public be concerned?
Well, AMR refers to antimicrobial resistance. And
there it is.
I was telling you before that an antimicrobial covers all the drugs that fight these tiny organisms. And antimicrobial resistance comes about most commonly when patients who may not have needed this antibiotic or this antiviral, etc., at all, or whatever underlying issue they have does not warrant the use, and you overuse the drug, then you can end up with organisms basically learning how to not be affected by that drug. Mm-hmm. And the thing about these microbes is that they don't keep the information to themselves. So you may have been trying to kill an E. coli or a Klebsiella, which are types of bacteria, and they decide to share the information about how to make resistance genes with a totally different bug that now is able to evade the same drug that would have been effective for it before.
Yeah.
And if we continue down this trend, it doesn't just happen sometimes when you get these resistance genes that it's just one drug that is resistant to. It can be resistant to various groups of antibiotics or classes of antibiotics. So you may say, okay, I would use this drug this time, it didn't work, and I can switch to something else. A time may come where you don't have something to switch to because these bugs have learned how to be resistant to all the classes of antibiotics. And it sounds like it's something far off, but it's happening around the world. It's happening. We see some bugs now in our labs that we're at a loss as to what are we going to tell this physician to treat this patient with because it's resistant to everything.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
Why is it dangerous for anybody to seek antibiotics without a prescription?
Okay, so it's dangerous for persons to seek antibiotics without a prescription because, as mentioned earlier, there's the risk of resistance. So essentially what that means is that there may come a time where a medication may be recommended for you and you're not able to have that antibiotic, meaning it will not be as effective as it should be because there has been possibly an overuse of the medication. So essentially, the body will not respond as it should, essentially. So that is really one of the risks. So it may seem very simple, but in the broad context, it puts the patient possibly in years to come at a risk in terms of their health, in terms of finding an actual option to treat the patient. So that's really one of the major risks that's involved.
Okay, thank you for that clarification. I think that was necessary to ask. I do want to ask this one too. What are some of the risks of treating the wrong illness with antibiotics?
So one of the issues that we have when we use any drug class inappropriately is you increase the risk of you having an adverse event or a reaction to that drug without any benefit. So everything in medicine or everything in life, I think you can work it down to a risk versus benefit ratio. Yeah. There is nothing in life that is all good and no bad.
Yeah.
There's nothing that's going to be all bad and no good.
Yeah.
And we have to think about how these drugs, how your body will respond to a drug. In this case, an antibiotic. If there is no infection that it can treat on board, you're giving yourself all risk and no benefit. So some people are familiar with penicillin allergy. People are familiar with things like peanut allergies. Because sometimes peanut allergies can be deadly. Yeah. Just even smelling the peanut or interacting with peanut dust can kill someone. There are people who have allergies to antibiotics, which are actually deadly. They can go into what we call anaphylaxis and die. Some people may have less severe reactions. They may just have vomiting and diarrhea, skin rash, things like that. But why expose yourself to probable death or what we say morbidity when you're not going to get any benefit from it? So that is one of the risks of taking antibiotics when you have no bacterial infection on board.
Yeah. I mean, yeah, sure. Go ahead.
On that note, just to point out that it's also important that to understand that if you receive a dose of an antibiotic, it doesn't mean that that's the same dose that the person that you'd like to share the medications with may require. That person may have kidney problems, meaning they have kidney impairment, and so their dose would need to be adjusted. So it's not a one size fits all. And so it's really, really important because you may be, as Dr. Blake mentioned earlier, you may be causing more harm than good in trying to assist that person. So it's important to understand what is happening with the person before going ahead and saying, you know what, we have the same symptoms, and so I think it's the same medication. This medication will help you. Or if you have 2 children in a household, even though their doses may not be the same. So you may say, okay, well, one is 5 and one is 10, so I'll just give one child a teaspoon and give the other a half a teaspoon. Mm-hmm. It's not quite as simple as it sounds. And so you're essentially putting that child at risk or putting that other member of your household at risk by trying to prescribe medications, antibiotics that have not been recommended by a physician.
Yeah. Yeah. And you know, there was something that you said earlier, Camille. It's just about, obviously you may be allergic to antibiotics. How do you know? Like, maybe I'm asking the wrong question or maybe I'm asking the right people. Yeah. But how would you know if you were allergic?
That's a really good question. And there are ways in which we can predict things, but the only way to truly know, unfortunately.
Yeah. Is to take it.
Is to actually test to see how your body will react to certain things.
Oh, wow.
So we will know based on history. We said that antibiotics can be in certain groups or classes. So we know if you're allergic to one member of that family or that class, you are very likely to be allergic to all the members of that class. So as physicians, we will know, and this is another thing why you need to go to a licensed clinician.
Yeah.
We will know what are members of that family, and we'll be able to pick from a different family to give you. So if you have an allergy, let's say as a child, you received penicillin because you're having a teeth pulled or something like that. Mm-hmm. I would know as a clinician that I can't give you amoxicillin or Augmentin, a commonly used antibiotic. But your friend who just came off their plane and you're like, oh, you're coughing, you have a runny nose, you have a sore, let me give you some Augmentin. They may not know that you're actually allergic to that entire family of antibiotics. Another way we can predict is, that there are certain genetic markers that make people more likely to have certain allergies. So in other centers, we can actually do allergy testing for those genetic markers for people who are at very, very high risk for infections. So let's say if you're in a cancer center or something like that, they can do typing of your kind of genetic type for HLA typing, which will help to predict what you could be allergic to. Additionally, if we have a suspicion that you're allergic to something, we can do blood tests, which can give us a general basis on which to avoid certain groups of things, whether it be foods or drugs. And the most risky, but the most reliable way is to do a skin prick test, which is usually done by an allergist, where they actually make little small indentations into the skin and they expose you to minuscule quantities of that particular drug or what we call an antigen. And you monitor your body's natural response by measuring amount of swelling or redness that you develop to that area.
Yeah.
So it's a best guess most of the time. We take a history from you. We'll take your family history. Have you been exposed to anything that has caused you to develop wheals or rashes? You feel like your airways closing off, or have you ever been intubated and in the ICU after receiving any drug? And based on that, we can make our best guess as to what you may be allergic to.
Yeah.
Unfortunately, oftentimes when you self-medicate, you're unaware of the correct choice, as we discussed earlier. You'll also be unaware of the correct dose, as Ramone said earlier, and you'd also be unaware of the correct duration. And if you get any one of those 3 things off, you have given a foothold for the bacteria to develop resistance. It's learning. They're growing and they're learning. They may not have a brain, but they function as a unit.
Yeah. And
you give them a chance or opportunity to be able to survive the initial onslaught of that antibiotic. If you just happen to choose the correct one, you'll provide them an opportunity to survive the initial onslaught. And those surviving members are a little bit hardy. They're war-torn bacteria, and they can learn based on the experience of that conflict, how to survive another attack by the same bacteria or by the same antibiotic, or by a similar antibiotic in the same group or with the same mechanism of action. So if you think of it like a battlefield, if someone keeps coming with the same attack, once you've learned their attack, you can subvert their attack. Yeah. So that's assuming you've chosen the correct antibiotic. If you choose the wrong antibiotic, for example, we generally split our bacteria into what we call gram-negative and gram-positive. Only certain types of bacteria can treat gram-negative organism. So if you have picked something that can treat gram-positive, but you have a gram-negative infection, the attacks won't work. So you're shooting arrows at a stone wall. It just won't work at all. And the other issue is if you treat it for too short a time. So certain infections will require prolonged courses of antibiotics or antimicrobials in general. If you have a toenail fungus, you may require weeks of treatment for a fungus, months. Yeah. Versus if you have just a little abscess, an abscess might only require a week of antibiotic therapy. So unless you've gotten the proper diagnosis, even with Dr. Google, you'd be hard pressed to come to the correct choice, the correct dose, and the correct duration.
I love that. And just the way you articulated it too, explaining this is a different one, antibiotics, and just like the ways that it's needed, which we're going to ask some more questions just around why it's needed for that long and why people should take the recommendation of their doctor when they said, hey, you need to take this at this period, because there are some people that will take themselves off because they say, hey, I feel better. It looks better. I don't need this anymore. Like you said, good old Google, Dr. Google may have told them that something completely different that contradict what the doctor said, right? Now, earlier we mentioned that there are some countries, we didn't mention any names, but maybe something next door, would bring in, of course, antibiotics. Can we talk about why that is considered unsafe or even perhaps illegal for it to happen?
So it would be considered illegal to take in antibiotics into the country without a prescription, essentially. So if it is that the medications have not been prescribed for you and you've taken it into the country, you would essentially be going outside of the law by taking that medication, by importing those medications into the country. And again, as we highlighted earlier, there are numerous risks that are involved because there are also side effects that patients can develop from self-medicating with antibiotics that have not been prescribed for them. So there is more risk with doing this than benefits, I would say. And back to your question that you asked earlier about not utilizing or using the recommended antibiotics for the recommended duration. Yeah. That in and of itself is a risk. And why is that so? Despite the fact that you may be feeling better, if you've not taken it for the complete course, what may happen is that you're essentially at risk of developing resistance because you would not have treated the microbe or that organism for the specified duration. So essentially, studies have been done to say, okay, for this infection, it's required, a course is required for 7 days or for 10 days. And if you decide, okay, I'm going to take it only for 3 days and then you're feeling better, the next time, if you develop a similar infection, the risk exists that the antibiotics may not work. So even though you may be feeling better, it's best to take it for the prescribed course.
Now, we know what a doctor's role is into prescribing it and why they prescribe it, but what is your role as a pharmacist to make sure that people are using these drugs safely, the antibiotics specifically?
So our role as pharmacists are to ensure that patients are thoroughly counseled so patients understand why the antibiotics have been prescribed for them. We also have a role in ensuring that if it is that the patient does develop any adverse reactions to the medication, they are aware of what to expect and what to do if they do have these adverse effects, meaning side effects of the medication. So if the patient develops a rash, if they start having headaches, anything that's untoward, we have a role to ensure that we educate persons so they know what to expect, essentially. We also have a role in ensuring that the right dose has been prescribed for the patient and ensuring that there are no interactions with the medications that have been prescribed. So our role is quite unique, and I would say it's quite diverse.
Love that. Thank you so much for answering that so well. So this one is a little bit different. What does antibiotic stewardship mean? What is the meaning behind that?
So antibiotic stewardship is a coordinated effort by various members, whether it be the physician, the patient, the pharmacist, the nurse, with the goal of ensuring the appropriate antibiotic is used in the appropriate time for the appropriate duration to minimize adverse events associated with those antibiotics use. And it has the added benefit of decreasing healthcare costs.
Yeah.
So it's a coordinated effort by all members of the healthcare team to ensure that we limit not only the patient exposure, but also the environment's exposure. Because if you think about it, if I take an antibiotic, my body is going to excrete it in one of two ways. That goes into the water table, it goes into the water stream. If you have poor sanitation or sewage control, then the animals could get exposed to it, and that can cycle back into your food chain, and you can inadvertently be exposing everyone who relies on this one planet Earth that we share to antibiotics that they didn't consent to taking. So it's a One Health approach where we realize that animal health impacts human health, impacts environmental health, and the concern is to ensure that whenever we prescribe drugs, particularly antimicrobials, we're doing so in a safe manner.
Yeah. You know, growing up in the Caribbean is quite different. One of the things I know for a fact is there is some culture difference when you are here in the Caribbean compared to the United States, right? Just how we raise our kids, how we speak to our kids, how we speak to each other, even in relationships and friendships. I think one of the things that I've always heard Caribbean parents do or say is that if, for instance, give you an example, the baby won't sleep, give him a little bit of Ray and Nephew. Right? That will put him to sleep. That will knock him out. And parents have actually done that, right?
Absolutely.
And then you see some parents go as far now. It's stepped up. It's morphed a little bit. I'll just prescribe him because in my previous life, I was a doctor, so I'll just prescribe him some Tylenol or Advil PM.
Yeah,
PM, the adult version, if there's ever a kid version, by the way. But I remember as a child, my grandma had a lot of medication run around the house a lot of the times. And I want to say it was God that kept me alive because a lot of times I was always fascinated and wanted to try the medication. Nothing ever happened. Nothing ever happened. But the reason I brought that up is because learn from my silly mistakes. Keep your medication away from your kids, especially the one that we are discussing right now. But I do feel that this question is necessary only because we may get into a point where we don't want to go and see a doctor. And a lot of the times because of financial restraints or just issues. And you're saying, I got to do something. And maybe a parent is saying, I want to just give my child probably a leftover antibiotic. Now, can we talk about why, and it's leftover or a little piece, can we talk about why that is something you should never consider doing?
Well, essentially, it ties into what we were discussing before, because if something is left over, that means one, the first person didn't complete the course, so they didn't take all of what they were supposed to take for the deterioration that they were supposed to take.
Exactly.
And then you would not usually have enough for a full course for the next person that you're about to share it with.
Yeah.
1. 2, you don't know what you're treating. So it's best that this patient goes to a physician. They assess them to see what's the likely organisms that we're dealing with.
Yeah.
Gram-positive versus gram-negative, bacteria versus virus. Are we actually giving this kid or somebody else the right drug to cover what you're trying to treat?
Yeah.
And then sometimes I think we forget sometimes too when we talk about antibiotics, we're thinking just the suspensions that you drink and the tablets. But especially where I'm from, we like to rub on creams.
Yeah, yeah.
And there are a lot of antibiotic creams and ointments, a lot of which are actually sold over the counter as well. And you basically are training the bacteria in your wounds, in your, just on the skin, wherever, that, hey, this drug here, you need to find a way to figure out how to not die.
Yeah.
So it picks up those resistances or turns them on if they already have them. Now, that may not be a problem for this person with the cut that just used some of somebody else's mupirocin or something, right? But If they live in a household with a grandma that has a long-standing chronic wound, and they now inadvertently shared those bugs with grandma, whose immune system isn't able to fight that off, and it ends up getting into her bloodstream, then we can develop what we call sepsis, and that person can be very ill. And when they get to the hospital, I'm wondering, how did they get such a resistant bug when they've never been exposed to antibiotic? But inadvertently, they were exposed to bacteria that was exposed to an antibiotic from somebody else. So it's important to bear in mind also that those little creams that we like to rub on, those antibiotic creams, you should use them with care as well.
Yeah. Thank you so much.
I'd actually like to touch on that point as well.
Please.
And I'm speaking to myself too. I just like to encourage everybody every few months, probably twice a year, go through your medicine box at home. Look at the things that are expired.
Yeah.
And throw it away. The things that you can safely throw away. For those things like antibiotics, call your local friendly pharmacist, like your friendly local Spider-Man.
Yeah.
And you find out from them how safely to dispose of it, whether you need to carry it back into the pharmacy to have it disposed of appropriately, or whether it's something you can bag up and discard in your trash can at home. Because like she said, I think we're all subject to having some sort of antibiotic ointment at home.
Mm-hmm.
Yeah.
Because it comes as standard in that little first aid kit that you purchase. And we rarely ever check the expiration dates on those things, but they will lose their efficacy over time.
Yeah.
And you'll just keep applying, and just a little bit of that antibiotic is enough to expose the bacteria for it to develop resistance, even if it's not acting to kill the bacteria.
Very dangerous, man. As we talk more and more about what this drug can do, and if not properly used, I mean, it's used to help people and save people in a lot of cases. But if not managed correctly, that's why it's important to do interviews like this. And you're putting your life at risk and other people around you. Okay, so superbugs. Let's talk superbugs. What is a superbug, first of all, and have we seen it here in Cayman?
Well, there are several bugs that we refer to as superbugs, but the term generally is used for those organisms that show resistance to several classes, if not all classes of antibiotics, at least one drug from each class. And there are several different types of organisms that can be referred to as superbugs. The ones you may hear of are, for example, MRSA. You've heard that term before? Never. Well, let me tell you about it. Right? MRSA stands for methicillin-resistant Staphylococcus aureus. Long name, so just say MRSA.
Yeah.
And Staph aureus is a bug that can be on just about anybody's skin. But there's a specific group of Staph aureus that tends to be resistant to this drug that we refer to as methicillin.
Yeah.
But once we see it having the gene for resistance to that, we know it's resistant to a wide array of antibiotics, and therefore they're very difficult to treat. It's in some settings, MRSA is pretty common, especially if the person has been in the hospital a lot. In some countries, it's very common. Mm-hmm. And it can cause death because it's difficult to treat. The drugs that we have to use to treat a serious infection with MRSA can be detrimental to your kidneys, to your ears, to yourself, right? So it's important from that perspective. All of these bad superbugs, we tend to have to use very high-powered drugs to treat them. And sometimes those drugs carry with it their own risks. You have to weigh the risk versus benefits. Yeah. Then you have, for example, VRE, vancomycin-resistant enterococcus, which is another gram-positive organism that can show resistance to vancomycin. Now, vancomycin is one of those super drugs that we reserve for particular types of infections, including the MRSA.
Yeah.
So imagine now you have a bug that is resistant to the top of the top, you know. Yeah. That's a problem. And then I'll give you another example. Neisseria gonorrhoeae. Mm-hmm.
I've heard that one.
Yeah, you'll hear about that one.
Yeah.
No, recently, when I say recently, it's probably a couple of years, they've been noticing that there are only certain drugs that can be used to treat gonorrhea. Yeah? But they've noticed that there is a special strain of Neisseria gonorrhoeae that's resistant to the drugs that we typically use to treat it. So there'll come a point, or there has already come a point, they have seen this organism where there's nothing to treat it. Can you imagine that you get infected with gonorrhea and we can't treat you? Yeah. And then the thing is, because persons aren't aware, the risk of spreading this multi-drug resistant organism around is easy. Yeah. So it's important for us to spread the news about the fact that superbugs exist. And superbugs, it's really just organisms resistant to a majority of the drugs that we currently use to treat it. And the drugs that would be restricted for use for these kind of organisms are definitely very expensive. definitely very high powered, and definitely usually come with a lot more side effects. Let's put it that way. So it's important to know that they exist and how best to avoid them.
Wow. Very detailed. I love it. And I think that you guys feel the same way too. I do want to take it into the lab for a little bit, guys, because we did speak about resistance bacteria. Have you encountered this in the local lab setting before?
Certainly we have. I think MRSA is actually one of the superbugs that is more commonly isolated here on island. And we have encountered one or two, not very common, the VREs that Dr. Reynolds referred to. More recently, we've seen very resistant Pseudomonas aeruginosa. And when we see organisms that are that resistant, it forces us to use way more resources because we have to double check to make sure that our results are correct. Then we have to use an extended panel to run to see if there are any other antibiotics it could possibly be sensitive to, including antibiotics we don't even have on island.
Yeah.
You know, because we may need to source these antibiotics now and bring them in to treat a patient. And most recently, we had an isolate that we had to refer to a reference facility overseas just to do further testing on it to see if we can identify any other antibiotics that it would be possibly sensitive to. And, you know, when we think of bacteria, we like to think of more common bacterial isolates, you know, but you have to think about tuberculosis as well.
Yeah.
And drug-resistant TB is something that is recognized as a global threat. And unfortunately, from time to time, you will have patients who have tuberculosis. We're a very, should I say, cosmopolitan society. People fly in and fly out. And TB is one of those things that's a public health risk. So if we ever get into a scenario where we have multi-drug resistant TB circulating, we'd be in a little bit of a pickle because we now have to source very expensive, very difficult to find drugs to bring in and store on island. Because one of the things people don't think about is drugs cost money to store.
Yeah.
They require special storage conditions. And once they go bad, you can't use them past that, their time of best use. It's not like those, right. It's not recommended. It's not like a best before date where you just continue using the product. So our efforts are always to try to minimize the risk, which is why I think it's so important to have everybody on board. You know, we could be of one mind at the hospital, but the patients are a big part of this relationship and this initiative and this strategy.
Absolutely.
So if the community can take this on as something of individual significance, I think we could really win this fight against antimicrobial resistance.
Yeah. You know, your job, obviously, it's a very important one. You guys seem a lot of times that you have time to figure things out, but then also it feels like you're racing against the clock. Has there ever been a situation where you guys felt like, man, I'm frustrated because I really just can't figure this out? And has it turned out to be a rewarding situation for you guys? I'm only asking you this question because, you know, as we come to a wrap up, I'm going to jump to ask our pharmacist. I'm going to dig into her job a little bit, but I wanted to ask you ladies in your department, have you ever felt like that feeling like I can't get this done, and especially racing against the clock, but it ended up being something that was rewarding at the end for a patient or many people?
Mm-hmm.
Well, there may be many instances, but my mind immediately goes back to a case of a patient, not here, but she had a urinary tract infection because she had underlying kidney disease, she had stones, she had a stent in, so she was a complicated case. And she kept getting recurrent urinary tract infections. She finally ended up with a bug I call in all these names, but forgive me, Burkholderia cepacia. And it was resistant to 21 different antibiotics that we tested against. We had no clue what we were going to treat her with. And there was no time to bring anything in. The good thing was that she wasn't particularly ill at the time. So it was one of those where, thank God, the bug she had, it wasn't causing systemic effects at the time. So basically, it was on a wing and a prayer, cranberry juice and water.
Wow. Because
we had absolutely nothing. There was nothing for us to bring in because the drugs just didn't exist. And this is an issue that we have because drug companies don't want to make new antibiotics because as soon as they make them, there's resistance. So they don't make any money off of it. So there has been a very tremendous lag in the production of new drugs. So what they've been doing is basically using the old ones and combining it with something else to see if it will work a little bit better.
Yeah.
So that's mainly where we're at. I mean, we probably get one new drug every couple of years nowadays. So to end up with an infection that you can't treat and you're trying to source something to treat it, it may be absolutely impossible.
But it also costs millions of dollars. I was reading this book recently with a guy that kind of ran a multi-billion-dollar company that produces drugs, and he talked about like when developing the drugs,
research and development.
Yeah, it costs millions of dollars for you to find out this drug probably doesn't serve a purpose. It doesn't work. So going behind the curtain is something that I strive to do, especially with jobs like you guys, because a lot of people don't understand how complicated it really is. And I think that was one of the most scariest parts during COVID, was a drug that was turned around so fast, which was the vaccine that people were supposed to take. And we're like, how do we take this? Because this was told that we needed it right away. So is it safe? And that's like I said, complete different interview, ladies. But it's just one of those things. It digs deeper into your job to find out how detailed you guys have to be.
Yes.
And I think that's very important. Before I ask you guys like the last question before we end the show, I want to jump to our pharmacists really quick, because I think one of the things that really kind of get under people's skin when it comes to going to a pharmacy is, why do I have to wait this long? So I want you to protect your job. I want you to let people know.
It's important to wait.
Yeah.
Why is it important? Because we have to make sure it's the right drug, the right patient, the right dose, the right doctor. We have to do all these checks. And we also have to ensure that, as I mentioned earlier, there are no interactions with the medications. We have to check the patient's kidney function if it is that we do suspect that they have some kidney impairment, or if it is that they have a liver impairment. So it's not just quickly taking something off the shelf and putting it in a bag. We have to make sure what we're giving to you is safe for you, because essentially we are the last point before that medication gets into the patient's body. So we would like to, just be very fast to say, yes, you'll go home in 2 minutes, in 3 minutes, but have we done justice for you? Meaning, have we made sure that we have done all our checks and balances to make sure that everything is safe for you? That is really our role. So we do understand that, you would like to get the antibiotics quickly if it is that the doctor has prescribed it, for example, oral antibiotics, then, we have to do all those checks to make sure it is safe.
So important. I mean, I acknowledge that, and I know that. So I have so much patience when I deal with a pharmacist. But I think one of the things I really respect about individuals that work in the medical field is, I used to think it was lack of emotions, but I feel like you guys obviously have emotions, but you have to contain it, especially doctors and what you guys do. Everybody. It's not only doctors. Because I remember once when I was very young, we were going through a very traumatic situation where, a family member had to be rushed to the doctor, and it was life threatening. I just remember the doctor was so, I don't know how to explain it. He was very not affected by the situation. And it was a bad situation. You're around so many people that are crying, but he's professional. He's staring into her eyes. He's giving the advice. He's saying, hey, we still need you to tell us what you want to do, because each area of what I'm about to do, something could happen that's bad, right? It could end up being either way. I remember that I was so upset in how he reacted and just how he was going on. He needed an answer right away. I was like, you have no feelings. And he said, what good would that do you now?
Absolutely.
Would that save your loved one? Would that help? And to this day, a lot of my family members felt that was rude, but I respected him so much with him saying that, because you look at each career that are out there, including what you guys do, is you have to lose that element. The same thing with a pilot. I don't want a pilot to panic in the middle of an emergency situation. And I don't want my pharmacist to be like, oh, I don't know. I don't know what to do here. Or let me rush this for you. Right? You go home and that's it for you. So everything, like you guys doing the same thing with developing these medicines or fighting bacteria or what you guys do in the background, it takes a certain level of patience, I believe. So, that leads me to my next question. Like, how there is a next young lady that's right now at this current moment sitting in the car and saying, I like what they do. How can I get involved? What do I have to do? What are my steps? What does it look like? So I kind of want each of you guys to touch on that and just give that young lady a little bit of hope today to say, maybe this is for me, maybe it's not, or what do I have to do to get into this?
Okay, so if it is that you are considering pharmacy as a profession, I would say you have made an excellent choice.
Yeah.
So my recommendations would be first to decide which country you would like to study in. Would you like to study in the Caribbean? For example, there is a University of Technology in Jamaica where an undergraduate degree can be obtained. Or is it that you'd like to study in the United States or in the United Kingdom? So essentially, you would have to assess first where would you like to study, and then establish what are your current where are you currently? Meaning, what level of studies have you already done? And if it is that you need further advice or further information, we have numerous pharmacists at the HSA, and I definitely am more than happy to guide you. You can always come by. Your pharmacist is there. We can help to guide you along the way, because we have, aided many students in terms of helping them to find the right path in terms of direction to further their studies in terms of pharmacy. And just to let you know, there are numerous options in terms of pharmacy. So it's not to just say, okay, you will be working in a community setting or even within the hospital setting. There are numerous areas that you can specialize in. There's oncology. You can be a diabetes educator. There's anticoagulation. There's pharmacogenomics. So there's a myriad of areas that you can actually explore. There is research. So you essentially would have to review and decide what area do you like? Is it that you prefer an area where you will be interacting with the patients daily, or is it where you prefer more of an administrative role? So those are areas that can be considered. But if it is you have any questions, feel free to come by any one of our locations, or one of our pharmacists will be happy to guide you.
I love you broke it down with the categories. I absolutely love that. All right, man. This one is of course very special because I've only found out about the field today. So yeah, it was my first time. I did not know. Pardon my ignorance, but please let that young lady in that car that was once your age way back, let them know what it's going to take for them to be your career or your job.
Okay, so we described for you before that we completed medical school first, and then you have to now go on to specialize. If you're going to choose to specialize in the area of medical microbiology, you also have to understand that, you're going to have much more limited clinical in terms of going to see patients on a daily basis like you would in a clinic or that kind of setting. So you would have to make up your mind that this is a laboratory science. Is this where I want to go? Do you want to limit your patient contact? Or, because it's a hard choice. When I started, my mentor made me actually, do a month or two and see whether or not I liked it, because I loved being in clinics. I loved the rapport with patients at first. But then after a while, I realized, I want to specialize, but this is not for me anymore. And I loved microbiology as a science from before, so I went down that path. The other thing to note is that as a clinical microbiologist, you can, depending on the facility that you're working for, like us, we would cover bacteriology, virology, immunology, parasitology. But then you have persons who, if you're in a larger setting, you may choose to just be an immunologist. So you specifically work in that part of microbiology that you like. I love mycology, but we really love it here. I love the fungi, right? But so you can choose to work in the specific areas. There's a lot of research in the field as well. There's teaching. It's multifaceted, really. So I find it exciting. I think probably what also helped me was going to a conference, an international conference, and just seeing what was out there. People were developing new techniques for identifying organisms or running the tests that made it easier and easier, and technology is taking off. Some persons have diverted into just looking at the technology of identification of organisms, molecular biology and all of these things. So it's multifaceted. There's always going to be something for someone, and it's to just read around it, see what you would really like, look at research, and if it is that you can come in contact with persons from the different areas, you can do that. I think the HSA has a very good program.
A summer internship.
Summer internship.
I've heard about it.
It's a fantastic, it's a fantastic program. Absolutely. Where you can get first-hand, hands-on experience in various departments. I know for our lab, we have students that come through our lab, and these people are at various stages of their educational career. High school, they're in college, they're thinking about what they want to do for the next 10 years.
Yeah.
You know, I want to speak directly to the young people, you know, young girl or young boy. You don't have to make up your mind today what you're going to be doing 20 years from now, right? Think about plans in the short 5 years, 5 years, 5 years. If you break it down to 5-year groups, it makes life seem not as overwhelming.
Yeah.
And you don't have to work with patients at all. You don't have to do anything related to human microbiology. You could be doing environmental microbiology. Let's say your love is dolphins. You can focus your microbiology specifically as it relates to marine life.
So good.
You know, or even let's be a little bit more granular. We've discovered bacteria that can break down plastics. So maybe your heart is in environmentalism and, you know, you're concerned about the CO2, green gases and all these things. You can work to identify bacteria that can help to break down those forever chemicals that we, Glendee and I, wouldn't have a clue about how to manage those things.
Yeah.
So do not restrict yourself. Like Ramone said, figure out not only where you want to study, but where do you want to practice? Where do you see yourself settling down? Do you want to stay at home within the Cayman Islands? And start to set the groundwork to lobby, to, you know, get the ear of the right people to say, I think this is a specialty that is needed here.
Yeah.
You know, when I first came to the Cayman Islands, microbiology wasn't a specialty that was here. But, you know, you start to lay the groundwork, you start to lobby, you know, I think we're going to need a microbiologist here. I think, you know, we need an infectious disease specialist. I think we need these types of things here. So you identify things that you're passionate about, things that are important to you, and seek out those people who are annex. You may not be able to find somebody directly in that field, but a field that is annex. Hang out with them, you know, get a mentor in that field. They can help to guide you. And I think we've all three of us have been mentors to people younger than us to guide them along the way. So just reach out to, well, where would it be? Marketing at the HSA? I think it would be the marketing team.
It's the HR department. We've done this, because we've talked to so many people and they've mentioned this program. This shows how wonderful it is.
It's a great program.
Yeah. Just reach out to the HR. They did it in summer. I think they continue to keep doing it every summer, but they might do it outside of the summer holidays also. So especially if you have that interest in it. But I think two key words that we're going to take away from what you guys said to wrap up the interview is the passion and seeking a mentor is extremely important, right? But the passion, I saw the passion here. Like if I could do a video, just your face, how it lights up when you guys are talking about your job, just show that you guys definitely picked the right field. So ladies, thank you so much for being a part of the interview and hope this is not the last time that we see you guys.
Yeah.
All right. Have a good one.
Thank you.